Good morning and welcome to the 5th virtual town hall on the coronavirus. My name is Roz Hamlet and I'm the PIO for the county executive. We're continuing to work together through all of this uncharted territory, and everybody is bringing their A game. As always, we're broadcasting on WNAV and on the county cable access stations. Today we have our fearless leaders with us, as always. In addition to the county executive and the county health officer, we will get reports from our fire chief, Trish Wolford, and our police chief, Altomari, or Chief Alto, as he's affectionately known. Mr. County Executive, would you begin?
All right. I'll not try to speak through this. So thank you for tuning in to our 5th weekly COVID-19 virtual town hall. Passover began on Wednesday. Tomorrow is Easter. The air is warming, the grass is growing, and the trees are in full bloom. No virus has the power to block the rebirth of our spring, and no virus has the power to weaken the spirit of the good people of Anne Arundel County. I'll report to you today on our work to slow the spread of COVID-19, on how our communities are being impacted by that effort, on how your local government is being impacted, and close with some predictions about the rebirth of our economy on the far side of this battle. So globally, COVID-19 has claimed the lives of 100,000. In our country, 494,000 have tested positive and 18,562 have died. Modeling suggests that we should prepare for 100,000 deaths, or 5 times the number we have lost to date. Maryland has 7,000 confirmed cases and has lost 171 lives. Anne Arundel County has 554 confirmed cases and has lost 16 lives. For those interested in tracking the data here, our county health department has posted a COVID-19 dashboard with charts and a map showing cases by zip code. Some argued that the public should not view that data, that people in zip codes with low numbers would disobey stay-at-home and social distancing orders, and that people in areas with high numbers would be stigmatized. I disagree. The battle to slow the spread of this virus is in the hands of our people, and our people deserve to know where we stand. You will notice that my peers in our neighboring counties will be posting similar data in the coming days. You can view ours at aahealth.org. You may remember me noting in recent weeks that Dr. Kalyana Raman and I were pressing the state for access to their modeling efforts so that we could work with our hospitals to plan for a surge of patients. I can't overstate the importance of that planning, and I'm very glad to report progress on that front. Dr. Kalyana Raman is one of 2 county health officers now participating in the state's surge planning, and he and his peers in other counties are working directly with researchers at Johns Hopkins and elsewhere to monitor the trends as we move forward. We have said all along that we need far greater testing capacity to effectively fight the battle. We need to know not only the strength of our enemy, but exactly where it is hiding. We have the delivery systems to do testing, but we are still suffering from early inaction, both at CDC and in the private sector, to produce the test kits that we need. We continue to prepare for the testing capacity that is promised so that we can conduct the tests at drive-through sites and elsewhere when it's ready. Finally, I want to address equity. One of the things that nurtures our spirits as human beings is when we act on our deep respect for life. Nothing in this world gives us a greater sense of purpose than saving lives. And when we recognize that all lives have the same inherent value, we truly fulfill our potential as communities. In the field of public health, all kinds of data exist to show that in our country and in our county, access to health care, general health, and even life expectancy depend largely on census tract, race, and household income. The limited data that exists tells us that the loss of life to COVID-19 is greatest among African Americans and people with lower incomes. On Monday afternoon, Anne Arundel County will hold its first meeting of the COVID-19 Health Equity Initiative. Its stated purpose, in the words of our health officer, is to make sure that health equity stays on the table during our outbreak response, and that our collective work aims to protect vulnerable and marginalized communities from COVID-19. The battle to slow the spread is, of course, impacting our communities. Last week, over 10,000 of our residents filed for unemployment insurance, putting us over 22,000 in a 3-week period. The weekly report I received from our team at Anne Arundel Economic Development tells me that the 150 businesses that they've been in touch with are struggling with access to the federal stimulus funds, frustrated that the state has had to close applications for its small business grant and loan programs due to depletion of the funds, and are very concerned about their ability to reopen once the closures are lifted. Anne Arundel County Food Bank reports a 200% increase in families receiving food at local pantries. Our schools and senior centers are distributing meals in quantities never seen before. Application for SNAP benefits or food stamps are at an all-time high. Teachers are adapting to a new way of teaching. Students are acquiring Chromebooks from the schools and logging in to their classes. People are hunkering down at home, getting to know their families better than ever, and maybe getting to know themselves in a slower-paced environment. And more people are doing the right thing by wearing masks of one sort or another when they go out in public. Anne Arundel County government continues to function. It must. People need our services now more than ever. This is where I give thanks to all of the public servants who wish they could stay home with their families, but go out every day to pick up the trash, clear the roads, operate the landfills, respond to emergency calls, or go to an office where social distancing is being practiced, but the risk of infection is still present. While local government must function, it also must pay its bills. I've spent recent weeks poring over spreadsheets with our budget team and senior leadership putting together the pieces of a budget for the fiscal year that begins July 1st. Revenue projections are down $63 million from what we expected when we began budgeting a month ago. Most of that loss is from income tax revenue. Amusement tax, real estate transfer tax, local sales tax, property tax, and investment income are also declining. The budget we present on May 1st will be fiscally responsible and fair, but it will be lean. Our priorities will be saving lives through public health initiatives and protecting our residents from the impacts of the coronavirus battle. One thing that we will not do to balance the FY21 budget is to raise the taxes that you pay. Your county income tax rate will hold steady and your property tax rate will drop slightly. I wish I could lower taxes more, but we're relying on local government during this time to meet critical needs in our communities. We can't do that without revenue. I spoke in recent town halls about the Federal CARES Act. Anne Arundel County will receive an estimated $100 million in direct assistance for COVID-19 response. We can't use that money to balance our budget, but it will be very useful as we pay bills associated with battling the virus and protecting our residents from the economic pain. I've been in regular contact with all of our congressmen and both of our senators advocating for additional assistance for our communities and positioning our county to get every bit of federal help that is authorized. That brings me to the part of this battle that we discuss the least but may worry about the most. How will we rebuild our economy after this? What will it look like? Those are the questions I ponder at the end of the day. Let's look at what we know will exist as we begin the rebuilding process. Infrastructure. Unlike a hurricane, a flood, or a war, COVID-19 does not destroy the buildings, the factories, the roads, or any of the property that is essential to operating businesses. Ownership could change, but the tools do not. Workforce. The economy that we rebuilt after the Great Recession of 2008 and 9 eventually employed all but 3% of our workforce locally. These are skilled workers who are ready to start producing as soon as businesses start hiring. That is a huge asset. Capital. With help from the federal treasury, money exists. I worry about too much of it ending up in the hands of very few, but that is a problem that can be fixed, just as it was after the Great Depression when America came together and built a middle class. Fourth is the entrepreneurial spirit. We have creative people in this county and in this country. We have people who know how to start a business and know how to run a business. And we also have people ready to learn those skills. But here's the part that gives me the greatest optimism. We have a renewed sense of community. Think about it. All of us, not only in America, but everywhere on this planet, will be coming out of our homes, reconnecting with each other. It won't even matter if you were friends before. We will be glad to be alive and glad that we saved lives. Every one of us will know that we helped by sacrificing for the greater good, for the one thing that matters more than anything else to all of us, to our health, to staying alive. We will rebuild our economy, I believe, with less greed, more care for our neighbors, more equity, and greater respect for the natural environment that embraced us in our loneliest times. Voters will elect leaders who reflect those values, and businesses that reflect those values will succeed. I got a call from a very forward-thinking business person last night. He told me that he has a lot of potted flowers that might bring some pleasure to people who are having a rough time. Maybe to the seniors when they pick up their meals at senior centers. Maybe to the kids to take home to their parents when they pick up their meals at our distribution sites. Wow. Thank you, Brian Riddle and Homestead Gardens. Let's grow some flowers together. It's now my pleasure to introduce our next three speakers. We have our County Health Officer, Dr. Nilesh Kalyanaraman, our Fire Chief, Trish Wilford, and our Police Chief, Tim Altamari. The Capital Gazette wrote in a recent editorial that I picked good people. These three are not only good people, they are really, really good leaders. It is absolutely essential that the people in these positions have the respect of those who work under them and the communities where their people work. All three have done that, and their leadership is a big part of why we will come out of this stronger and more united than ever. Okay?
Thank you, County Executive. It's good to be with you here again on this fifth Saturday. I will start, as I always do, noting the importance of social distancing and infection control. We talk a lot about preparing for the worst, but at the same time, we have put into place many strong measures so that we don't get to the worst. And over these next few weeks, we're really going to see the effects of what our social distancing, what our business closures, school closures, and what our infection control measures have brought us. And so it's critical now, particularly as we hear different news reports of how different cities and states are doing, and how we are doing here in Maryland and in Arundel County, that you maintain these efforts. You saw that I just took my mask off, and really that's just so that I can speak clearly into the microphone. But I've been keeping my mask on in public. And this is a collective action issue, and we know that. Each of our actions, no matter how small, matter. So every time you keep 6 feet from someone else in public is another instance where you're decreasing the risk both for you and that other person. Every time you telework, if that's an option, you are decreasing risk. Every time you wipe down and disinfect a frequently touched surface, you are decreasing risk. And it's important, particularly now that we're more than a month into this, where it gets really hard to keep it up, that you do so, and you do so even more. That's part of the reason why we've released additional data. We released that map, and I agree with the county executive. We are asking each of you to take these actions, and so each of you deserve to have information about what the effects of those actions are. If there are small numbers in your zip code, keep up your efforts. That's how they'll stay small. If there are larger numbers, it might be time to increase your activity in terms of social distancing and infection control. When we talk about what this looks like over the longer term, we've really focused on these few weeks, these few months, but this isn't going to go away. We're not going to be done with it in the summer or the fall. It's going to be here. COVID-19 is going to stay with us. And so some of the changes, yes, they are temporary, but some of them are going to be here with us for a long time. We are actively discussing this both at the county and the state level as to what those steps are, what they look like. I will say that our testing capacity is increasing by the day. Our testing turnaround time is decreasing by the day. We're doing better on that front. There are more tests being run. It's taking anywhere on average now from about 2 to 4 days for test results to come back. On average, it's about 2 days at this point. And we're really excited about that because it means that we can be more in real time in terms of how we are addressing symptoms and addressing isolation and quarantine. I mentioned that some things are going to be here with us to stay for a while. One of those is us really paying attention to the symptoms that we have and staying away from others when we do. We used to give lip service to that before, and I'm just as guilty as anybody else of walking around with colds and maybe the first symptoms of a flu and pushing through. But it's precisely because we've stopped doing that we're seeing the successes that we are. And so we're going to have to continue to do that for a long time. At the same time, we maintain a focus on vulnerable populations. Those people who, whether because of age or chronic disease, are more not just susceptible, but susceptible to poor outcomes, including death. We've been working diligently with our nursing homes in concert with the state to ensure that they have the guidance they need, not just to take care of their current residents, but also to be able to take admissions safely into their facilities, to make sure that they have the PPE that they need and that they have the personnel that they need. We've been working with assisted living facilities to do the same. We continue to focus on homeless populations to make sure that people who are in shelter are safe and that people who are unsheltered are able to be sheltered quickly so that we can protect both their health and the health of others. And we have a particular focus on health equity. Health equity is something that we have been talking about, and it's the opportunity for everybody to achieve their optimal health. Those concerns don't go away in the context of a pandemic. In fact, they get amplified in this context. Disparities that existed before only get worse. And we're seeing that. We're seeing that vulnerable and marginalized communities are doing worse in this pandemic. The state released data that we see a disproportionate number of the positives in the state are African Americans. We see reports from elsewhere in the country that there's a higher death rate for African Americans and for individuals who are poor. And so in our county, we are going to keep that as part of our focus, and that is why we are on Monday bringing together community leaders from around the county to discuss what are the gaps that are being seen and how we can quickly address those. While we have talked for a long time about the drivers of those disparities, we know they're there. Our goal is much more short-term. How do we deal with it right now? And so in this time where we are banding together, in this time where we are each looking out for each other and are doing it through the challenges of not being able to be physically near each other, I want to note some thanks. One, this is Public Health Week, and I want to give my thanks to all of the people at the health department, over 700 staff who, even in the best of times, work quietly and in the background. Their job is to make sure things don't happen. Public health is most successful when we prevent diseases and outbreaks from happening. And yet now they are more visible than ever, and they have risen to the challenge, and I thank them. I also want to thank Councilperson Sarah Lacey for my masks. She saw my half-witted efforts in making masks last week and offered to make them for my family and myself, and I thank her for that. And lastly, I want to thank my family who have put up with my near absence for the last month. I could not do this without them, and I want to give them a shout out. And with that, I will turn it over to Police Chief Trish Wolford. Fire, sorry.
Thanks, Doc. I can talk for both of us. Good morning, Anne Arundel County. Thank you for joining us today. Just a couple of things that I want to go over about your incredible fire department and what we have been doing. The role of the fire department has not changed during these extraordinary times, but what has changed is everything about what we do and how we do it. While we're still running calls for service and we're still taking care of the community, our preparations and the way that we close out calls has definitely changed. So just for example, the PPE that we wear has changed. We may look very different than what you're used to seeing on calls. Our 911 call processing has changed, where now every caller is being screened for signs and symptoms of COVID-19. How we transfer patients in the hospital has changed, and the procedures that are being used within the hospital for how patients enter has very much changed for us. We're learning new medical techniques, and we're learning new medical procedures, which is something unique for our EMTs and our paramedics. The decontamination process has become much more robust, and it's definitely a key point of what we're learning and how we're training. All of this requires a great amount of training into our day, and the amount of information that our firefighters and EMT must process has been extraordinary in such a short period of time. We have new protocols that we've been abiding by and working with the state. And one of the greatest changes that's the most difficult for many of us, including myself, is our limited access to the public. Our public engagement, our community meetings, just being out with all of you and the public has been very difficult for a lot of us. So with that, some of the other changes I want you to know about is we are starting a new state pandemic protocol. Other jurisdictions have been doing this protocol, and it's a portion of it is a no transport policy. And what that means is if you call 911 and you are having some of those COVID-19 symptoms, but your care would be better served at home, you now have the capability to stay at home if that is your choice instead of being transported to the hospital. And then one of our clinicians will follow up with you within 24 hours by a phone call. So you get the opportunity to talk to one of the paramedics. We go over your signs and symptoms. We see how you're feeling the next day, and then we can make another assessment that day of whether or not you want to go to the hospital or you'd like to remain home where it could be safer for you. That's something that'll start tomorrow morning at 0700. Another change that is difficult for a lot of people is family members are not allowed into the hospitals currently. Our two main hospitals, Anne Arundel Medical Center and Baltimore Washington Medical Center, are only taking the patients that we are transporting. There is a no visitor policy. This can be very difficult when we're on scene with patients and a husband or wife or a grandparent or a sibling wants to go with us to the hospital. And it's difficult for us to say no, just as it is for many other times. But it's important that you understand we can only take the patient right now, and the hospitals would not allow those visitors to come in with you anyways. The only exception is if you are a minor, then you are allowed to have one parent or guardian with you. But again, that can be a difficult conversation for my clinicians when you're on scene. So please keep that in mind if you need our services right now. The last thing is for adults and kids. We have just rolled out our annual report. I'm incredibly proud of the annual report. It's got some great photos of all of our first responders. There's some great information. You can find it on the county website under the fire department. It's over on the left-hand side toolbar, and just click on annual report, and it guides you through our virtual report. And then for kids and adults, if you haven't joined us on Facebook under Anne Arundel County Fire Department, you'll see we're adding virtual firehouse tours for the kids to look at. We've added friendly EMT and friendly firefighter videos so you know what we look like in all of our new PPE. And then we're continuing to add updated videos of home escape plans, how to be prepared in the event of an emergency, and maybe other additional items that you'd want to work into your homeschooling and homework. So my last thought is for all of our providers in the field and our first responders. Thank you for everything you do. I am incredibly proud of the work that you always do, but right now when the stress and the anxiety is so high and there is so much, I would say, so much reliant on you as the front line, I thank you for remaining calm and serving this community. I know that we have one of the best communities around, and it's because of what you do day in and day out. Thank you.
Thank you for having us, sir. Good morning, Anne Arundel County. I'm setting my timer because I'm a long talker. Thank you is my message to the county today and to the ladies and gentlemen that I work with. To the men and women of the Anne Arundel County Police Department, I want to tell you for the 1,000th time how proud I am of you. I know you're afraid. I see it in your eyes when we're talking. And as usual, you set that fear aside and go out and get the job done for the citizens we've sworn to serve. I'm extremely proud of you. In Arundel County, we're doing okay. We've put some things in place on your police department that can be frustrating, I think, just as the fire chief talked about. We're pushing a lot of calls for service that can be brought to a successful closure through distance intervention, to online reporting and to telephonic reporting, and that is simply, as Dr. K alluded to reduce interpersonal contact and thus reduce the chance that we have large numbers of our police department go down out of service at any given time and not be able to get to you when you truly are in trouble. Thank you for dealing with that. Thank you also for giving the gift to your police department that we are one of the jurisdictions in the state who have not had to make an arrest solely for a violation of this emergency order. That isn't down to the cops, it's down to you. Thank you for listening. Thank you for allowing them to be diplomatic. And on those occasions where their directions became a little less than diplomatic, thank you for rolling with that too. We appreciate it greatly. We're doing okay on the police department. We are out there every day, all day, just as we've always been. We have had 3 employees test positive and be diagnosed as having the COVID-19 virus. Only one of those employees to date has had to be hospitalized and receive serious in-depth treatment. That employee, a lieutenant of ours, has come home. He's doing much better, and we appreciate your thoughts and prayers. On any given day, we're running about 10 to 15 employees that we have to have isolated because of potential exposures, illness, one way or the other, things of that nature. We can sustain 10 to 15 every day for eternity if we need to, so we're doing fine. As Dr. K alluded to, we need your help to continue keeping those numbers where they are. The isolation protocols that you're putting yourselves through, you're working with us on doing things by phone, that's what's keeping the numbers on the police department in ranges that allow us to stay viable as service providers. I am extremely concerned about a group of folks in Anne Arundel County who are isolated at home in abusive relationships. If you are one of those people, we will bring help to you if you need it. The YWCA and I had a call earlier in the week. Their domestic support services numbers are way down. And that means that people aren't calling when they need help because they're afraid the YWCA is closed. They are not. They are open for business, and they will help you get out of the situation that you're in. They will bring the supports you need to keep you safe. Their hotline number is 410-222-6800. Please make the call if you need the help. I'll close with this. We're in a great position to keep going and keep everybody safe in Anne Arundel County. Keep putting the work in to help us do that, and we'll be there for you every day. Be safe.
Thanks very much, Chief Alto, and everyone else for those very thorough reports. I'd like to begin with a question to Dr. Nilesh, who said during his remarks that things have changed and in what sounded like a very permanent way. Are handshakes and hugs a thing of our past?
They're not. So physical contact is important for each of us in our day, whether it's with loved ones, friends, acquaintances. They're not. But we're going to have to think about them more. Are handshakes just routine handshakes going to be as important, or are there other ways to signify an acknowledgement of somebody? Are hugs a routine part of your day? With whom? A lot of these things we're going to have to think about. We're going to have to think about how do we change our greetings? And I know that's really challenging. It's challenging for me. It's challenging for others. And so as we go along, we're going to have to figure some of these things out, and we'll be there with you to help figure that out.
Thank you. Mr. County Executive, can you tell us about one of the most inspiring stories that you've heard about during the crisis?
Well, I told you about the call I got last night from Brian Riddle at Homestead Gardens with this idea of distributing flowers, potted flowers, and that was inspiring. But on Thursday on Facebook, we started on the County Executive Facebook page, Thank You Thursdays. And the idea is that I would thank a person or a group of people. And I thanked teachers in our schools for what they're doing, how they're adapting to how they provide education to our kids. And in the comment section, I asked people to thank somebody or a group of people. And the comment that got the most likes on it would get a free certificate from Economic Development for a meal from the restaurant of their choice, a pickup meal, of course. And reading through those comments, I really recommend that you go there. It'll put a smile on your face. I can't remember how many there were, but people were thanking all kinds of groups, and just the gratitude and that feeling and sense of gratitude is just so positive for everybody. The one that got the most likes was thanking school nurses who are not working as school nurses, but our health officer has deployed them to do other work on the front lines of this battle. But there's so many groups to thank. There's so many great stories out there. But the ones that I'm closest to are in county government, and I'm seeing it all over the place. Just this last week, in putting the budget together, just working with the team in a really stressful environment, trying to figure out how to make the budget work. The creativity, how people just went above and beyond. It's all over the place. Thanks.
Thank you. Following up, the governor's actions follow projections by the state comptroller that Maryland could lose billions in revenues in just the next 3 months. What fiscal effect will the virus have on the county's economy? Will we need to dip into our reserve funds?
So I mentioned that our budget analysts have been watching that really closely and getting their information from the comptroller as well as other sources. And in fact, all of the county executives in the Big Eight, at least, have been on the phone with each other almost every day. And we brought in all of our budget officers to compare notes last week on projections of revenue moving forward. And so people are on the same page, working with the same data. I mean, I mentioned that 68 million less than we expected. It's a significant hit, and the big question is whether we're going to how quickly we're going to bounce back in terms of revenues. It's an interesting phenomenon, though, with the federal government, because the federal government, you know, they say the feds can print money. The feds don't have to balance their budget. We may have noticed that. The debt was already, unfortunately, at a historic high before this, and the debt is going to increase. But the economists and 100% of the Senate voted to do a $2.2 trillion CARES Act. They can inject money into the economy, and that's what's going on. So I know there was one question about the unemployment insurance and whether that money's going to run out and how long it'll last. That money doesn't run out as long as the federal government is willing to continue it. And so, no, it doesn't run out. The way the county and the state, who have to balance our budgets and can't print money, our money does run out. But the consensus among the economists is that this is a time to pump money into the economy and keep things going so that we can recover more quickly. That's the way they did the stimulus after the last recession, and it worked by all measures, I believe, and that's what's going to be happening this time. So, yeah, it's going to hurt, but we're going to come back.
Thank you. Now might be a good time to share just a word about how to apply for unemployment. You can call 410-949-0022. Claims center call hours have been extended to 7 a.m. to 6 p.m. Anyone with the last name that starts with A to F should file their claim on Monday. G to N should file on Tuesday, and O to Z on Wednesday. On Thursdays and Fridays, anyone can file over the phone, and on Thursdays through Sundays, anyone can file online. Let's return to some of our health.
Something on the unemployment insurance. Am I allowed to jump in?
Yes.
Okay. I mean, this is virtual, so you don't really know.
Yeah.
We've been getting a lot of calls from people at our call center here and elsewhere. The call center, by the way, is 410-222-0600 here at the Emergency Operations Center, and we have a team taking all calls. But it is the state through which you file for unemployment insurance, and they have obviously never had this kind of traffic before, and they're increasing their staff. They've got this new website, mdunemployment.com. And it's really difficult when you're one of the group that was not eligible before. So I think we've all read that in addition to full-time regular employees, that contract employees, self-employed, part-time employed can all apply. And the benefits are much better than they've been, because in addition to what you would get, you get an additional $600 a week. But for the folks who are in that category of the new group, they haven't figured out how to do that yet at the state level. And so they're putting together the guidelines in every state. And we're hoping that it's going to be within a week, 2 weeks, at worst 3 weeks. But they're gonna frustrate you, and they're going to say, you got to hold off. So trust that you will get the money and that it will be retroactive to when you stopped working. But getting into the system and getting it moving is a challenge for everybody.
Thank you. The COVID-19 pandemic has affected people across different continents, races, and socioeconomic groups. Communities are quarantined, schools are closed, and people are in social isolation. And this is affecting everyone, but no one more than our healthcare workers who are on the front lines. What are some of the issues healthcare workers are most concerned about? What do they need from their leaders? And what other sources of support do they believe could be most helpful to them? Dr. Kay?
So healthcare workers, in our conversations with them, are worried about a few things. They're worried about what's going to happen to the people they're caring for, and so that tracks along our discussions around making sure there's enough hospital capacity for those who get sick, particularly managing as we go along, as more and more people get sick, being able to manage that volume. They're also worried about themselves, making sure that they have enough PPE, and we've certainly heard more and more stories about PPE shortages, and we're working with folks, and our hospitals are as well, and our nursing homes are as well, in terms of how to make sure that not only do people have enough, healthcare workers have enough of that PPE, but also strategies to make sure that we're using it wisely and extending its use appropriately. And then there's just the added stress that comes from intentionally being in a situation where you're exposed to the virus. You know, we're asking everybody really to avoid going into spaces where COVID-19 is present, and yet we are asking our healthcare workers and our other first responders to specifically go into spaces where COVID-19 is. And that's challenging both for them and also for their loved ones, and how they can stay separate from their loved ones and not give it to them. And it's a really challenging time for them. And so, you know, getting to the idea of how do we help them? One way to do that is to make sure that if you have PPE and you're not a healthcare worker or first responder, donate them to those institutions that do need it. That's why we talk about the cloth masks, and we talk about the public not using N95 or surgical masks, but using the cloth masks. Ask your friends or your neighbors who are how you can help them. It's a challenging time, and I'll tell you a personal story. My wife is a physician, and we are making plans to be separate when she has to get called into the hospital. We're not quite sure how we're going to do that. But those are the moments where your supports that you usually rely on are not there anymore. And so call them up, ask them how you can help. And lastly, and I say this always, be kind. Be kind to each other and be kind to yourselves. These are challenging times, and kindness is a key part of how we will get through this.
Thank you. Let's turn now to some of our Facebook Live questions. What is the county's plan for antibody testing? When do you plan on it being available? And what's the process we anticipate in implementing widespread testing for this?
That's a great question. We're really tracking closely along what's coming out in terms of lab tests for antibody testing. I believe it's probably about a week and a half ago at this point that the first test was approved. But I think we're just way too early in the game to have a sense of when it will come online in any meaningful amounts for us to use. I think in the next few months, we should be seeing more and more of those antibody tests coming online, and it's going to be really key for us in two different ways. One is to get a better sense of how many people were actually infected. We talk about the fact that there's people who've had really mild symptoms who weren't tested, who may have had COVID-19, and just because they weren't tested, don't know. So we want to get a sense of how many people were actually infected. And that'll give us a really, really much better picture of what to expect going down the line. And then the second question, which is a bit more challenging to work through, is there's been discussion around antibody testing as a way to identify people who've already been exposed, who have some level of immunity, and whether we want to use those workers preferentially, particularly in healthcare and first responders. It's challenging, though, because we also don't want to make it so that only a small group of people have to do a lion's share of the work. But those discussions have certainly been around, and we'll have to tackle those issues as antibody testing becomes more prevalent.
Thank you. This next Facebook viewer has heard that the virus has gone airborne, but cannot find any confirmation on that. Is this true or just a rumor?
It's true. The virus is airborne, and that's actually how it's transmitted most often. It's why we talk about the social distancing, the
farther apart that you are, the less likely as you're breathing, or particularly sneezes or coughs, which shoot out air, but also small droplets, which can carry the virus if you have it. Having that distancing keeps you further away from that airflow. Wearing the masks, as you see myself and the county executive doing, helps to prevent the transmission of the virus as well. So it is airborne, and that is the basis for all of the recommendations that we've been making.
Thanks. This is a question for either one of you. What are your thoughts on the racial disparity in COVID-19 patients? Who wants to go first?
I can start. Okay. My thoughts are that the disparity that we see is another manifestation of the disparities that we've seen in other health conditions that have been going on for a long time. Frankly, it should not surprise us that a disparity that existed for decades prior continues in the face of a pandemic. We have had to change drastically how we make available healthcare services, and so those communities and populations which didn't have good access before, it was always going to get worse. And so that is why we are committed to figuring out quickly what are the gaps in the short term, and how do we aggressively address those to at least try to not just minimize, but to turn around those disparities in this time.
Yeah, and I mean, I talked about that in my opening remarks, and Dr. K and I have talked about this a lot, also in the context of what data exists and what we can put out. And I know that Delegate Mosby from Baltimore led a group in the General Assembly asking the governor to provide any data that they had, and I was pleased to see that he did just that. And I understand that information is not collected when a test goes to the lab, and then the results come from the lab, so the lab doesn't include that information. It can be collected, I understand, from the hospitals later for those cases, but one of the things that our COVID-19 health equity initiative is going to be looking at is how we can collect the data on the front end, so that we have the data, and how we can plan for all the work that we do so that it addresses the disparities. One of the things that was done right away was getting into the homeless shelters and the congregate housing facilities where people are vulnerable, and making sure that anybody with symptoms got tested as a top priority, and people getting separated. So I think that was really effective. I think our county moved quickly on that, and we'll have to continue to do that. But those are the kinds of things that we do to push back against the inequity problem.
Could either one of you share how many of our inmates in our detention centers are under observation for COVID-19, or if there have been any positive tests?
So generally, we're not releasing data on specific facilities. I can tell you that we've been working with our correctional facilities. So we have the 2 county facilities, but we also have a state facility in our county. We've been working with them for just ever since this started over a month ago with our 2 county correctional facilities, reviewing their plans, working with them in terms of how they would manage not just testing, but isolation and quarantine, how they're maintaining physical separation as much as possible. And I will say that it's been a great partnership. It always has been, but particularly so in this time, to make sure that we keep our inmates safe as well, and make sure that they get the healthcare and also the prevention that they need just as much as anybody else.
And I would just add that our superintendent of detention was on this right away, very quickly, and developed a list of things to do to protect the inmates, protect the staff. If any staff is infected, as a carrier, obviously would spread very fast, and we've been lucky so far, but it's obviously it would be a huge problem if we start getting positives in our detention center. One of the things that we did was to end the weekend sentencing program, where people would come in for the weekend and then leave. Had to go to the judge to get that approved. And I know that they're trying to reduce the population and prevent people from going in who have minor offenses who might otherwise be held before their trials.
Thank you. Mr. County Executive, I know that you were at the Arundel Food Bank yesterday. Would you talk about what you learned there, about what's needed and how people can donate?
Yeah, I've been following the comments and questions on Facebook here as well, and I know both Dee Dee and Christine have asked a question about donations and how to donate, and I'm glad you did. So I was at the food bank, and they reported that, Susan Thomas does a great job there, and they've reported a 200% increase in the numbers of families at the pantries. The food bank sends their food out to pantries, largely, where it's distributed. But donations are down. And part of the reason for that is the grocery stores are selling all of their product quickly. And so they're donating less. And so they're asking for financial donations so that they can actually purchase food in bulk. We're working as well, the county is working on identifying large bulk food outlets that we can get actually purchase food to get to the food bank to get distributed. And there are a lot of nonprofit organizations that Partnership for Children, Youth, and Families, which is a quasi-county agency, is working with a lot of the nonprofits, and people are doing a lot of food distribution through churches as well. Lots of great organizations doing it. But if you want to donate, call 410-222-0600, our call center here. Or you can go to the website at EOC at aacounty.org, but they will tell you what they need and how to do it. There's a donations management center that just opened about 10 days ago in Odenton. There's also the Anne Arundel County Food Bank in Crownsville that you can take food and other supplies too, household supplies, obviously if you have any personal protective equipment, or if you're sewing masks even, and they can get that stuff out. And you can also donate money. And one I think you can donate to the food bank. You can donate to any nonprofit of your choice, or there's the Community Foundation of Anne Arundel County that has a coronavirus response fund, and we work with them to make sure that those funds are spent where they're needed the most, and that's cfaac.org.
Thank you. I know also that you can text food to 41444 to make a direct cash donation to the food bank. Turning now to the subject of mask, we're now advised to wear face mask in public, but if we're home, should we also wear mask? This person says, I'm fine when I'm home, but I feel a great deal of anxiety when I have to leave my home. How do I manage my fear?
That's a great question. So generally, if you're at home and you're with the same people every day, we don't recommend a mask unless somebody is sick and having symptoms, and we recommend that that person who is sick and has symptoms wears a mask, certainly when they're interacting with others. In terms of anxiety and fear, that's really quite natural. This is a time of much greater anxiety. It's hard when part of what we're telling you is to take greater vigilance in everything that you do. And so part of it is being prepared, understanding what steps you can take to decrease your risk, and that's where our guidance around social distancing and masks and infection control comes in. And the other is finding ways that you can engage in activities that you enjoy. It's hard. Don't read the news. You do it once a day, but it's anxiety provoking, frankly. What can you do that gives you some temporary respite from the world, from its concerns? Can you go for a short walk? Can you read a book? Can you do something else that you enjoy? And so finding that and being kind to yourself and giving yourself permission and space to do that is really important as well.
Thank you. Does anyone have a projection for when the peak of the surge will occur in the county?
So there are a variety of projections. We are tracking along with them anywhere from the latter part of this month all the way into mid-May. And the challenge with projections is that they are just that. They are projections. They are based on what has happened and where we think they're going. but they don't factor in how effective our current interventions will be. So we're always looking to see what's actually happening with the data, how is it moving, what does it look like moving forward, and those projections are being updated. So that's why it's really hard to give you a prediction of, it's going to happen on this date. It's not going to. We will really only know as we look at the data what's happening, and what we're seeing are some encouraging signs, but we're, as I mentioned earlier, these next 2 weeks or so are really critical to our understanding of which way this is going.
Thank you. What is the dashboard telling us about the spread of the coronavirus? Are we able to tell if the people who have tested positive in the county are clustered, or are they kind of spread across the county?
So the dashboard and the map are telling us that it's spread throughout the county. We're also digging deeper to see where the tests have been done. So not just where the positive cases are, but the negatives as well. And turns out that data is a lot harder to be able to map out for any number of technical reasons. But part of our concern is to make sure that we're getting testing everywhere that it is, and that what the numbers we see just don't reflect availability of tests, but also the true spread of those symptoms.
Thank you. What steps are we taking to ensure that supermarkets, food distribution warehouses, and pharmacies within Anne Arundel are secured from burglary and looting and can operate safely during regular hours? We're bringing the chief up to the podium, yes.
That is a fantastic question. So one of the things that your cops who are out there 24/7, 365 are paying attention to is all the infrastructure things that the county executive talked about earlier, that Dr. K talked about earlier. So our hospitals are definitely in there. Healthcare providers are definitely in there. I will tell you candidly that burglaries are up a little bit, particularly commercial burglaries. As with any great event in history, and by great I mean huge, whether it's good or bad, we see the best of humanity and we see the worst of humanity. So we do have people who are trying to take advantage of this situation. Our grocery stores are getting very frequent checks. Part of the gift that Anne Arundel County has given its police department, and this gift has not been given everywhere in the country, is that we haven't had to station a cop at grocery stores for the whole time they're open. The officers are frequently checking the grocery stores. I hear it every day. And then overnight hours, many of our larger grocery stores do have staff in them overnight stocking the product that they can get back in, but they're getting checks, particularly those businesses that are food distribution centers that don't have staff in them overnight are getting checked multiple times each night. And I'll tell you, pharmacies are a concern of ours also. So we've had a couple big pharmacy burglaries lately. We've also had great success in finding out who did them and making arrests. And those people are getting charged on top of their burglary charges, their theft charges, with appropriate emergency order violations / looting type charges. It isn't large numbers, and that's a good thing, but we're doing pretty well out there keeping the numbers down where they need to be.
Thanks so much, Chief. With just the final minutes remaining, let's go for our final question to one of our constituents who emailed a question. She wants to know, will people's freedom to return to work, to support their families, to return to school, or to reopen their businesses be conditional upon first receiving a vaccine?
We don't have an answer to that question. Probably, hopefully not, because if that happens, that means that we're not going to be going back to work for about 18 months, right? Or a year, because of the time that it takes to get a vaccine approved. So while it sounds like it would be a great
a great thing to do. That would be very, very far out, and I think the expectation is that the numbers will be low enough long before that people will be going back to work.
Any
You wanna
final
add to that?
thoughts?
I will say that we have as the county executive noted, a vaccine typically takes, even in the best of circumstances, at least 12 to 18 months. Think of that in the context of the flu vaccine. When we come up on the flu season, we have a vaccine for the flu, and not everybody takes advantage of that. I sincerely hope that this time around in August and September, people take advantage of that, because our clamor for a vaccine for COVID-19 is right on, but we have one for another deadly viral infection. And so for those of you who want that, make sure you get your flu vaccine at least, so that one day when the COVID-19 vaccine comes out, you can get that as well.
Thank you. That brings us to the end of another virtual town hall. Thank you very much for joining us, and see us here the same time next week. Bye-bye.